Let me ask you something. What if the single most powerful thing you could do to protect yourself from cancer after the age of 50 had nothing to do with expensive medications, complicated treatments, or anything your doctor has probably already told you about? What if it was something so deceptively simple that most people overlook it completely? And what if the science behind it has been sitting in medical journals for years, quietly confirming what a small group of oncologists already knew? Stay with me, because in the next several minutes, I'm going to walk you through something that genuinely changed the way I counsel my patients. And I believe it could change the way you think about your own health forever. My name is Dr. Adrian Volker, and I've spent over 2 decades working in oncology. I've sat across from thousands of patients, delivered diagnoses I never wanted to give, and spent countless hours asking myself the same question: what could we have done differently earlier? And the more I looked at the data, the more I kept coming back to one area that doesn't get nearly enough attention in mainstream health conversations. I'm talking about chronic inflammation and the extraordinary role it plays in cancer development after the age of 50. Now, before your eyes glaze over at the word inflammation, I want you to stay with me, because what I'm about to explain is going to reframe everything you think you know about that word. Most people hear inflammation and think of a swollen ankle or a sore throat, something that hurts, something visible, something temporary. And that kind of inflammation, what we call acute inflammation, is actually your friend. Why? It's your immune system doing exactly what it's supposed to do. You get a cut, your body rushes resources to the site, fights off bacteria, repairs tissue. That's beautiful biology working in your favor. But there is a second kind of inflammation that is far more dangerous, precisely because it does none of those dramatic things. It doesn't swell visibly. It doesn't hurt in any obvious way. It just quietly smolders inside your body year after year, like a slow burning fire you can't see or feel. We call it chronic low-grade inflammation. And here's the part that should make every single person over 50 sit up straight. Research now shows that this silent inflammatory state is one of the most significant drivers of cancer initiation and progression that we know of. Let me give you the numbers, because this is where it gets real. A landmark study published in the journal Nature Reviews Cancer found that chronic inflammation is a contributing factor in approximately 25% of all cancers worldwide. Another major analysis tracking over 100,000 adults found that individuals with elevated inflammatory markers, something called C-reactive protein, or CRP, had significantly higher rates of colorectal, lung, and breast cancer over a 15-year follow-up period. 25%. Think about what that means in a world where 1 in 2 men and 1 in 3 women will receive a cancer diagnosis in their lifetime. If you're finding this valuable, do me a quick favor right now. Hit the like button below. It costs you nothing, but it tells the algorithm this information matters, and it helps me reach more people who need to hear this. Now let's keep going. So why does this happen? Why does inflammation create an environment where cancer thrives? Here's the science simplified. Your cells are constantly dividing millions of times a day throughout your body. Most of the time, your DNA replication process is remarkably accurate. But when you have chronic inflammation, you have persistent oxidative stress. That means your cells are being bathed in chemically reactive molecules called free radicals that can damage DNA during replication. When DNA gets damaged and that damage isn't caught and corrected in time, you end up with mutations. And mutations, over time, with enough accumulated errors, can lead to the kind of uncontrolled cell growth we call cancer. But it doesn't stop there. Chronic inflammation also does something even more insidious. It suppresses the function of natural killer cells. The immune cells whose entire job is to patrol your body, identify abnormal or precancerous cells, and destroy them before they can establish themselves. Think of these natural killer cells as your internal surveillance team. When inflammation is chronically elevated, that surveillance team is compromised. It's slower, it's less effective, and that's when the window of opportunity opens for cancer cells to slip through. Now, here's the part that surprises most of my patients. After the age of 50, your body naturally shifts toward a more pro-inflammatory state. This process even has a name. Scientists call it inflaming, a combination of inflammation and aging. As we get older, our immune system becomes dysregulated. It starts producing more inflammatory signaling molecules called cytokines, and it becomes less effective at resolving inflammation once it starts. Your lifestyle, your diet, your sleep, your stress levels, all of the things you may have gotten away with in your 30s. begin to have a compounding effect after 50 that they simply didn't have before. The game changes, and most people don't know the rules have changed. So, what is this simple method I mentioned? What is the single most evidence-backed intervention I share with my own patients when it comes to managing chronic inflammation and reducing cancer risk? It is something called a Mediterranean anti-inflammatory dietary pattern, combined with one specific daily habit that most people are either doing wrong or not doing at all. Let me start with the dietary piece, because this is where the research is absolutely overwhelming. A massive European study called the EPIC study, the European Prospective Investigation into Cancer and Nutrition, tracked over 500,000 people across 10 countries for more than a decade. What they found was consistent and clear. Individuals whose diets were rich in colorful vegetables, legumes, whole grains, olive oil, fish, and nuts had dramatically lower rates of several cancers compared to those eating a typical Western diet high in processed foods, refined sugars, and red meat. In some cancer categories, the risk reduction was 30 to 40%. Now, why does this pattern work so well against inflammation? Because every single food group in a Mediterranean-style diet contains compounds that interrupt the inflammatory cascade at a molecular level. Take extra virgin olive oil. For example, it contains a compound called oleocanthal that works through a mechanism similar to ibuprofen. It inhibits the same inflammatory enzymes. Except, unlike ibuprofen, you're not taking it as a drug. You're drizzling it on your salad every day. Leafy greens like spinach, arugula, and kale are loaded with folate and antioxidants that protect DNA integrity during cell division. Fatty fish like salmon and sardines are rich in omega-3 fatty acids, which have been shown in multiple studies to lower circulating levels of inflammatory markers, including interleukin-6 and tumor necrosis factor alpha, two of the key molecules that drive chronic inflammation. Berries, blueberries, strawberries, raspberries, contain anthocyanins and resveratrol, powerful polyphenols that have been studied specifically for their anti-cancer properties. More cutenics. A study published in Cancer Research showed that resveratrol can actually interfere with multiple stages of cancer development, from initiation all the way through to progression and metastasis. These aren't fringe findings. This is peer-reviewed science published in the most respected medical journals in the world. Quick pause here. If you're not subscribed to this channel yet, now is the time. I release a new video every week covering evidence-based health and cancer prevention topics that most people simply aren't getting from their doctors. Click subscribe and make sure the bell notification is turned on so you never miss one. Now, back to what I was saying, but here's what I tell every patient who walks into my office. Oh, the dietary shift alone is powerful, but it is not complete without addressing what I consider to be the single most underrated cancer prevention habit available to all of us: consistent, moderate daily movement. I'm not talking about training for a marathon. I'm not talking about 2 hours at the gym. I'm talking about 30 to 45 minutes of moderate intensity movement every single day. Walking briskly, swimming, cycling, whatever you enjoy enough to actually sustain. And the reason this matters so profoundly is not just about burning calories, it is about the extraordinary biochemical changes that physical activity triggers in your body at the cellular level. When you engage in moderate aerobic exercise, your muscles release compounds called myokines, signaling proteins with potent anti-inflammatory effects throughout the body. Exercise also reduces circulating levels of insulin and insulin-like growth factor, both of which, when chronically elevated, create a hormonal environment that favors cancer cell proliferation. The American Cancer Society, in their most recent guidelines, stated that physical inactivity is one of the most important modifiable risk factors for cancer, second only to smoking and obesity, and yet it remains one of the most ignored recommendations in clinical practice. Here's a statistic that stopped me cold when I first read it. A large meta-analysis published in the British Journal of Sports Medicine found that individuals who met the recommended guidelines for physical activity had a 20 to 30% lower risk of developing colon cancer, a 20 to 30% lower risk of breast cancer, and significantly reduced risk of endometrial and lung cancers compared to people who were inactive, 20 to 30%. With walking. This is not experimental. This is established science. Now, I want to pause and address something I know some of you may be thinking. You might be thinking, Dr. Volker, I already knew I should eat better and exercise more. This isn't new. And to that, I say, you're right that the advice isn't new. But here is what is different about what I'm telling you today. It's not just that these habits are good for general health, it is the specific mechanism. It is understanding that you are not simply trying to lose weight or feel better. You are actively, measurably, molecularly reducing the inflammatory environment in your body that makes cancer possible. When you frame it that way, when you understand exactly what you're doing and why, the motivation changes, the consistency changes. There is one more piece to this that I cannot leave out, and it is the one my patients consistently underestimate. Sleep. Specifically, the quality and duration of sleep after 50. While you sleep, your body does the cellular repair work it cannot do during waking hours. Your DNA repair enzymes are most active during deep sleep. Your immune system consolidates its defenses. Your body clears metabolic waste products through a system called the glymphatic system, one that is only fully activated during sleep. And here is what the research shows. On a chronic sleep deprivation, defined as consistently getting fewer than 6 hours per night, is associated with significantly elevated inflammatory markers and impaired immune surveillance. A study in the Journal of the National Cancer Institute found associations between shortened sleep duration and increased risk of colorectal and breast cancer. 6 to 8 hours of quality sleep is not a luxury. In cancer prevention terms, it is medicine. Before I wrap this up, I want to ask you something. Do you have a parent, a sibling, a close friend over 50 who you think needs to hear this? Share this video with them right now. Don't wait. You could genuinely be giving someone you love information that makes a real difference in their health. The share button is right there. Use it. Okay, and if you have a question or a thought about anything I've covered today, drop it in the comments below. I read every single one, and I respond as often as I can. So let me bring this all together, because I want you to leave this video not just informed, but empowered, with a clear picture of what you can actually do starting today. After the age of 50, your biological terrain shifts toward chronic inflammation. That inflammatory environment damages DNA, suppresses immune surveillance, and creates the conditions in which cancer can take hold. The research is unambiguous on this, but you have 3 powerful evidence-based tools that address this at the root level. First, an anti-inflammatory dietary pattern, prioritizing colorful vegetables, legumes, olive oil, fatty fish, berries, and whole grains while reducing processed foods, sugar, and excessive red meat. Second, 30 to 45 minutes of moderate daily movement, curing consistent enough to trigger the anti-inflammatory effects of myokines and reduce the hormonal drivers of cancer cell growth. Third, 6 to 8 hours of quality sleep, giving your body the nightly repair window it needs to maintain genomic integrity and immune function. None of this requires a prescription. None of this requires expensive supplements or cutting-edge treatments. It requires understanding your body well enough to give it what it actually needs at this stage of life. And that is exactly what I am here to help you do. I've seen patients in their 60s and 70s make these changes and watch their inflammatory markers drop significantly in just 3 months. I've seen people who came into my office convinced that cancer was inevitable because of their family history leave with a completely different understanding of how much agency they actually have. Your genes are not your destiny. Your environment, including the internal environment of your body, is something you have far more control over than you may have been led to believe. If this video gave you something valuable today, here's what I need you to do right now. Hit the like button. It genuinely helps this channel grow and puts this information in front of more people who need it. Subscribe if you haven't already, and turn on the bell so you never miss a new upload. I post every single week, and every video is built around the kind of evidence-based health information that can actually make a difference in your life. And in my next video, I'm going to reveal why one of the most commonly consumed breakfast foods is quietly elevating inflammation in millions of people who think they're eating healthy, and exactly what to replace it with. You won't want to miss that one. Thank you for spending this time with me today. I'm Dr. Adrian Volker, and I'll see you in the next video. Stay well.